Hello everyone, welcome back to my channel. Today I'll be covering the pharmacology MCQs. So this is a complete revision video of general pharmacological principle. Now let's start the video. So the first question is, drug administered through the following route is most likely to be subjected to first pass metabolism. So the options are oral, sublingual, subcutaneous, rectal. So the correct answer is option E, oral. Moving to the next question. So the next question is, an orphan drug is, the options are a very cheap drug, a drug which has no therapeutic use, a drug needed for treatment or prevention of a rare disease, or a drug which acts on a orphanin receptors. So the correct answer is option B, option C, a drug needed for the treatment or prevention of a rare disease. So orphan drug is a drug that needed for treatment and prevention of a rare disease. Now coming to the next question. The next question is, transdermal drug delivery system offer the following advantages except. So the options are, they produce high peak plasma concentration of the drug. Option B is, they produce smooth and non fluctuating plasma concentration of the drug. Option C is, they minimizes the inter-individual variation in the achieved plasma drug concentration. And the option D is, they avoid the hepatic first pass metabolism of the drug. So the correct answer is option E. They produce the high plasma peak concentration of the drug. Now moving to the next question. The next question is, which of the following drug is administered by intranasal spray or application for systemic action? So the options are phenylephrine, desmopressin, azilastine, beclomethasone, dipropionate. So the correct answer is option B, desmopressin. Now moving to the next question. The next question is, compared to subcutaneous injection, the intramuscular injection of the drugs, options are, is more painful, produces faster response, is unsuitable for depot preparation, and carries greater risk of anaphylactic reaction. So compared to subcutaneous injection, the intramuscular injection produces faster response. So option B is the correct answer. Now moving to the next question. The next question is, select the route of administration which carries the highest risk of adversely affecting vital functions. So the options are intraarterial injection, intrathecal injection, intravenous injection, and intramuscular injection. So the correct answer is option C, intravenous injection. So intravenous injections has highest risk of adversely affecting vital functions. Now coming to the next question, majority of drugs crosses biological membrane primarily by, the options are passive diffusion, facilitated diffusion, active transport, and pinocytosis. So the correct answer is option A, passive diffusion. So majority of drugs process the biological membrane by passive diffusion. Now moving to the next question. The next question is, diffusion of drug across the cell membrane. The option are, is dependent upon the metabolic activity of cell, is completely competitively inhibited by chemically related drug, is affected by extent of ionization of drug molecule, and it exhibits saturation kinetics. So the correct option is option C. It is affected by extent of ionization of drug molecule. Now moving to the next question. The next question is, alkalinization of urine hasten the excretion of, the options are weakly basic drugs, weakly acidic drugs, strong electrolytes, non-polar drugs. So the correct answer is option B, weakly acidic drugs. So now moving to the next question. The next question is, which of the following drugs is most likely to be absorbed from the stomach? So the options are morphine sulfate, diclofenac sodium, hyoscine hydrobromide, quinine dihydrochloride. So the correct answer is option B, diclofenac sodium. Now moving to the next question. The next question is, which of the following is a weakly acidic drug? The options are atropine sulfate, chloroquine phosphate, ephedrine hydrochloride, and phenytoin sodium. So the answer is phenytoin sodium. Now moving to the next question. The next question is tricyclic antidepressant can alter the oral absorption of many drugs by options are complexing with the other drug in the intestinal lumen. The option B is altering the gut motility. Option C is altering the gut flora. And option D is damaging the gut mucosa. So the correct answer is option B, altering the gut motility. So tricyclic antidepressant can alter the oral absorption by altering the gut motility. Now the next question is bioavailability of drug refers to. The options are it refers to the percentage of administered dose that reaches the systemic circulation in the unchanged form. It refers to the ratio of oral to parenteral dose, or option C, ratio of orally administered drug to that excreted in the feces. And D is ratio of drug excreted unchanged in the urine to that excreted as metabolites. So the correct answer is option A. Bioavailability is the percentage of administered dose that reaches the systemic circulation in unchanged form. Now moving to the next question. The next question is the most important factor which governs the diffusion of drug across the capillaries other than those in brain is. The options are blood flow through the capillary, lipid solubility of the drug, pK value of the drug, pH of the medium. So the correct answer is option A, blood flow through the capillary. Now moving to the next question. Active transport of a substance across biological membrane has following characteristics except the options are it is specific, option B is it is pH dependent, option C is it is saturable, option D is it require metabolic energy. So the correct answer is option B, it is a pH dependent. Now moving to the next question. The next question is marked redistribution is a feature of the options are highly lipid soluble drugs, poorly lipid soluble drugs, depot preparation, and highly plasma protein bound drugs. So the correct answer is option A, highly lipid soluble drugs. So marked redistribution is a feature of highly lipid soluble drugs. Now, moving to the next question. The following attribute of a drug tends to reduce its volume of distribution. So the options are high lipid solubility, low ionization at physiologic pH value, high plasma protein binding, high tissue binding. So the correct answer is option C, high plasma protein binding. Now moving to the next question. The next question is the most important factor governing the absorption of a drug from intact skin is. So the options are molecular weight of drug. Option B is site of application. C is lipid solubility of drug. And the nature of base used in the formulation. So the correct answer is option C, lipid solubility of the drug. Now moving to the next question. The next question is bioavailability differences among the oral formulation of a drug are most likely to occur if the drug options are is, is freely water soluble, is completely water soluble, is incompletely absorbed, and it undergoes little first pass metabolism. So the correct answer is option C, it is incompletely absorbed. Now, moving to the next question. The next question is weakly acidic drugs are so they are bound primarily to alpha 1 acid glycoprotein in plasma. Option B is are excreted faster in alkaline urine. They are highly ionized in the gastric juice. And D is they do not cross the blood brain barrier. So the correct answer is option B. They are excreted faster in the alkaline urine. Now, moving to the next question. Which of the following is not true of the blood-brain barrier? So the options are option A, it is constituted by tight junction between the endothelial cells of brain capillaries and the glial tissues. The option B is it allows the passage of lipid-soluble drug into the brain. C is it limits entry of highly ionized drug into the brain. And D is it regulates the passage of substance from the brain into the blood. So the correct answer is option D, to regulate the passage of substances from brain into the blood. Now moving to the next question. The next question is the blood-brain barrier, which restrict the entry of many drugs into the brain, is constituted by. So blood-brain barrier is constituted by. The options are paraglycoprotein, efflux carriers in the brain capillary cells. B is tight junction between the endothelial cells of brain capillaries. C is enzymes present in brain capillary walls, and D is all of the above. So the correct answer is option D, all of the above. Now moving to the next question, a non-volatile, highly lipid-soluble drug is metabolized at a rate of 15% per hour. On intravenous injection, it produces general anesthesia for 10 minutes. Which process is responsible for termination of its action? So the option are metabolism in liver, plasma protein binding, excretion by kidney, and redistribution. So the correct answer is option D, redistribution. Moving to the next question. A prodrug is, so the option are the prototype member of a class of a drugs, the oldest member of a class of a drugs, an inactive drug that is transformed in the body to an active metabolite, a drug that is stored in the body tissue and is then gradually released in the circulation. So a prodrug is option C, an inactive drug that is transformed in the body to an active metabolite. So prodrug is an inactive form of drug. Now, moving to the next question. The next question is, which of the following is a prodrug? The options are hydralazine, clonidine, captopril, and enalapril. So the option D is the correct answer. Enalapril is a prodrug. Now, moving to the next question. The next question is, biotransformation of drugs is primarily directed to. The options are it activates the drug. The option B is it inactivates the drug. Option C is it convert the lipid soluble drugs into non-lipid soluble metabolites. And the option D is it converts the non-lipid soluble drugs into lipid soluble metabolites. So biotransformation of drug is it converts the lipid soluble drug into non-lipid soluble metabolites. Now moving to the next question. So the next question is the plasma protein bound fraction of a drug. So the options are it contribute to the response at the given moment. It remain constant irrespective of the total drug concentration. Option C is it remains constant irrespective of the disease state. And option D, it is not available for metabolism unless they actively extracted from by the liver. So option D is the correct answer. Now moving to the next question, high plasma protein binding. The options are increases the volume of distribution of drug, facilitate the GFR of drug, minimizes the drug interaction, and generally makes the drug long acting. So high plasma protein binding generally makes the drug long lasting. So now next question is microsomal enzyme induction can be a cause of. So the options are tolerance, physical dependence, psychological dependence, and idiosyncrasy. So the option A is the correct answer. Microsomal enzyme induction can be a cause of tolerance. Now moving to the next question. The following drug metabolizing reaction is entirely non-microsomal. So the options are glucuronide conjugation, acetylation, oxidation, and reduction. So the correct answer is option B, acetylation. Now moving to the next question. The most commonly occurring conjugation reaction for drugs and their metabolites is, so the options are glucuronidation, acetylation, methylation, and glutathione conjugation. So the correct option is glucuronidation. Now, the next question is the following is not true of the cytochrome P450 isoenzyme CYP2D6. So, it is the options are it generates the hepatotoxicity metabolite N-acetyl benzoquinone imine from paracetamol. It is involved in demethylation of codeine into morphine. Its altered form is responsible for poor capacity to hydroxylate many drugs, including metoprolol, and it is inhibited by quinidine. So the correct answer is option A. It generates the hepatotoxic metabolite and acetyl benzoquinone amine from paracetamol. Now moving to the next question. Glomerular filtration of a drug is affected by its. So the options are lipid solubility, plasma protein binding, degree of ionization, and D is rate of tubular secretion. So the correct answer is option B, plasma protein binding. So GFR of a drug is affected by its plasma protein binding capacity. So now next question. Drugs which undergo high degree of first pass metabolism in liver. So the options are they have low oral bioavailability, they are excreted primarily in bile, they are contraindicated in liver disease, and they exhibit zero order kinetics of elimination. So the correct answer is they have low oral bioavailability. Now moving to the next question. The next question is induction of a drug metabolizing enzyme involves the options are a conformational change in the enzyme protein to favor the binding of substrate molecules. Now the option B is expression of enzyme molecule on the surface of hepatocytes. C is enhanced transport of substrate molecule into the hepatocytes, and D is increased synthesis of enzyme protein. So the correct option is option D, it increased synthesis of enzyme protein. Now moving to the next question. The next question is select the drug that undergoes extensive first pass metabolism in liver. So the options are phenobarbital, propranolol, phenylbutazone, theophylline. So the correct answer is option B, propranolol. Now moving to the next question. Which of the following type of drug metabolizing enzyme are inducible? So options are microsomal enzyme, non-microsomal enzyme, both microsomal and non-microsomal enzyme, and mitochondrial enzyme. So the option A is the correct answer. Microsomal enzyme are the inducible enzymes. So which of the following is not a primary or fundamental but a derived pharmacokinetic parameter? So the options are bioavailability, B is volume of distribution, C is clearance, D is plasma half-life. So the correct answer is option D, plasma half-life. Now moving to the next question. If a drug is eliminated by first order kinetics, the options are a constant amount of drug will be eliminated per unit time. Its clearance value will remain constant. Its elimination half-life will increase with dose, and it will be completely eliminated from the body in two into half-life period. So the correct answer is option B, when if the drug is eliminated by first order kinetics, then its clearance value will remain constant. Now moving to the next question. The plasma half-life of penicillin G is longer in the newborn because their plasma protein level is low, drug metabolizing enzyme are immature, GFR is low, and tubular transport mechanism are not well developed. So the plasma half-life of penicillin G is longer in newborn because their tubular transport mechanism are not well developed. Now moving to the next question. If a drug undergoes net tubular secretion, its renal clearance will be, the options are more than GFR, equal to GFR, less than GFR, and equal to the rate of urine formation. So if a drug undergoes net tubular secretion, then its renal clearance will be more than the GFR. Moving to the next question. If a drug has a constant bioavailability and first order elimination, its maintenance dose rate will be directly proportional to its. The options are volume of distribution, plasma protein binding, lipid solubility, and total body clearance. So the correct answer is option D, total body clearance. Now, moving to the next question. When the same dose of drug is repeated at half-life intervals, the steady state plasma drug concentration is reached after. So options are 2 to 3 half-lives, 4 to 5 half-lives, 6 to 7 half-lives, and 8 to 10 half-lives. So the correct option is option B, 4 to 5 half-lives. So after 4 to 5 half-lives, there is a steady state plasma drug concentration is reached. Now next question, if the clearance of a drug remain constant and doubling the dose rate will increase the steady state plasma drug concentration by a factor of, the options are into 3, into 2, into 1.5 and into 1.3. So the correct answer is option B, into 2. Now the loading dose of drug is governed by its, the options are renal clearance, plasma half-life, volume of distribution and elimination rate constant. So the correct option is option C, volume of distribution. Now moving to the next question. The next question is, monitoring of blood levels of diuretic drug is not practiced because options are no sensitive methods for measuring the blood level of diuretics are available. It is easier to measure the effect of these drugs. Response to diuretics is not related to their blood levels, and the option D is diuretics need activation in the body. So the correct answer is option B. It is easier to measure the effect of these drugs. Now moving to the next question. Microsomal enzyme induction has one of the following feature. The options are, it takes about 1 week to develop. The result is an increased affinity of the enzyme for the substrate. It is irreversible and it can be used to treat the acute drug poisonings. So the correct answer is A. It takes about 1 week to develop. Now, monitoring plasma drug concentration is useful while using. So options are antihypertensive drugs, levodopa, lithium carbonate, and MAO inhibitors. So the correct answer is lithium carbonate. Now moving to the next question. The next question is, sustained or controlled release oral dosage form is appropriate for the following type of drug. So the options are an anti-arthritic with a plasma half-life of 24 hours, a sleep-inducing hypnotic with a plasma half-life of 2 hours, an antihypertensive with a plasma half-life of 3 hours, and analgesic with a plasma half-life of 6 hours used for relief of casual headache. So the correct answer is option C, an antihypertensive with a plasma half-life of 3 hours. Now that's all for today's video. Thank you so much. If you have any query or any question or any suggestion, then please let me know in the comment section. Till then, take care and happy learning. Thank you.